And Mr. Chair, those frontline.
Dr. Jackie Blue.
Thank you, Mr. Chair. I'm very pleased to be taking part in this estimates debate, and I'd like to congratulate the Minister of Health for his leadership in his portfolio. Vote Health was the biggest recipient of Budget 2011. It was one of the few areas to receive a modest funding increase, which will be paid through by making efficiencies in other government departments. This continues the government's election pledge to continue the growth of funding to the public health system. Budget 2011 is delivering an extra $2.2 billion to public health services over the next 4 years, including an additional $585 million in initiatives in the coming year. I'd like to particularly focus on 3 areas: medicines, rheumatic fever and maternity services. The budget included $80 million for wider access to medicines, and it is expected that around 32,000 patients in the first year will benefit from this extra funding. Together with the extra $100 million for medicines in the last 2 years, this means this government has invested an additional $180 million in total. Despite the serious economic environment, the government has continued to invest new resources into health to meet our commitment to a strong and enduring public health service. This is in contrast to the approach taken by several governments around the world who have slashed the funding of their public health services in response to the global financial crisis. In 2008, we made an election commitment to lift the pharmaceutical spending per head of population, and the extra $180 million will bring us up from $163 in 2008-09 to $174 per head of population 2011-12. And this means more patients are benefiting from community medicines and cancer treatments. Mr. Chair, in terms of the number of medicines funded, under this national government we have seen the most intensive program of medicine investment since PharmAC was created in 1993. Mr. Speaker, this government has acted on rheumatic fever. In the 2011 budget, $12 million has been allocated for this debilitating disease. Maori and Pacific people, most of them children, living in cold, overcrowded homes are most likely to get rheumatic fever, and they are 20 and 37 times respectively more likely to be admitted to hospital with first-time acute rheumatic fever than anyone else. It is a third world disease, and we need to eradicate it from our country. And it has been actually a health priority since 2001, but nothing has ever happened except more children got this disease. This $12 million investment in the budget this year is aimed right at rheumatic fever and will support a massive campaign across high prevalence communities involving school-based sore throat clinics for over 22,000 children. It's been a long time since I practiced in as a general GP, but the Minister was able to show us during the Select Committee of the throat swabs that are going to be used for these programs, and I hadn't appreciated they're actually on-the-spot throat swabs that are taken of children with sore throats, and they show whether they have strep throat or not. If they have a strep throat, they have an antibiotic, and that's it. If they don't need to have an antibiotic. And I hadn't realised that technology had advanced in the time that I'd left general practice, and I'm delighted that we have this program. It's going to make a real difference to children in those communities. Rheumatic fever is a terrible disease. It can lead to heart problems and basically a crippling chronic illness and a terrible outcome for children who need to have monthly injections, painful injections of penicillin, and they have a terrible outlook. So this is a fantastic program, long awaited. It's been waiting since 2001, and this government's doing something about it. Mr. Chair, Budget 2011 has new initiatives for maternity services and to help new mothers and babies. The budget provides an extra $33.2 million for maternity services over 4 years to improve safety and quality. A further amount of $21.3 million will boost well child services, with a particular focus on first-time mothers. The additional funding is expected to deliver an extra 54,000 visits to around 18,000 mothers who need this additional support. For these mothers, this will mean on average 3 additional well child visits up to the first 2 months of a baby's life. The extra $33 million for maternity service announced includes $18 million to improve the safety and quality of services for mothers and babies.
Grant Robertson.
Carry on.